Hi, this is Dr. Caitlin Herzog with LeBauer Physical Therapy here today to talk about how you can come back even stronger after an injury. Go ahead and click the subscribe button below, the like button, and the share button to share with someone who you think would benefit from watching this video. One of the ones that we received recently was the question, will I ever regain full range of motion? And will I ever get my strength back after an injury? Yes and yes. So essentially what happens when we do get an injury, sometimes there's tissue damage, other times there isn't. So we'll kind of talk about the tissue damage versus not tissue damage healing route. But essentially when you do get an injury, say that you had tissue injury, so maybe you strained a muscle, maybe you had a tendon or ligament injury. Essentially what happens is your body goes through the whole healing process. So for a little bit, you'll have some inflammation, but the inflammation is not a bad thing. It's actually a good thing because it means blood flow is coming to the area to help restore and rebuild that tissue. So you will have some inflammation for a little bit, followed by kind of a remodeling process. So your body starts to lay down new tissue. When your body does lay down new tissue, it kind of lays down in like this little wavy, disorganized, jumbled mess. And I say it kind of looks like tangled up spaghetti. So that's kind of what's going on there. Afterwards, your body kind of goes through this longer process of then organizing those new collagen fibers or soft tissue fibers. So essentially, that is going to take anywhere from 8 to 12 weeks. So yes, you can come back stronger after an injury, but you do have to have realistic expectations of how long your recovery is going to be. Usually just that healing process alone is going to be 8 to 12 weeks. During that healing process, our body tends to guard. So if you had maybe a hip, knee, ankle injury, your body will naturally want to put all its weight on the other side. You might limit your range of motion during that time. And that's essentially why you might notice that you are lacking in range of motion even after everything has healed. It's really important for us to reteach the body that it is safe for that joint to go through that full range of motion. Because essentially it was a protective mechanism and you just need to help your body learn that, hey, it is okay to, let's say, move my ankle through that full range of motion. So we see a lot of people with ankle sprains in our clinic, and a lot of times what happens is they will start to lack ankle dorsiflexion, or if you watch my foot here, so this is our lovely ankle dorsiflexion, or they'll lack some inversion eversion because their ankle just got really stiff while the ligaments were healing, and also during that swelling and inflammation phase, because a lot of the times swelling will limit our range of motion, and it's great that we have it for a little bit because we do need that in order to heal, but we don't want it to stick around forever. We do want to also start early mobilization to help get that inflammation out in a timely manner, because we've also seen people who have swelling long after an injury, and that can also be another sign that they just didn't move early enough when they were supposed to, and we just need to help the body relearn, hey, we don't need to constantly keep this area guarded. We can get down swelling in order to regain that full range of motion. In the ankle example that I gave, it's really important for us to regain motion at the ankle, especially in our athletes, because if you are limited in your ankle mobility, it can lead to knee pain, hip pain, trouble squatting, even like foot pain. So usually ankle limitations in range of motion will lead to pain in other areas of the body. So you might not necessarily feel pain in your ankle after the injury, but you might feel it in your knee or in your foot. So that's why it's really important for us, especially, even our weekend warriors, but even especially our athletes, to regain that full ankle mobility. That way we don't have problems down the road. So it's really important to know when it's okay to start moving that joint through the full range of motion. That way you can be on the fast track to healing. Once we regain that joint's full range of motion, then we can start to strengthen it. Basically, how we do that is by, once again, making the body feel safe in order to load it. So another thing that happens commonly with the injuries we see here in our clinic is that when the body goes through that healing process and it's guarding, the muscles all around that joint tighten up because they're trying to stabilize you and make you feel safe. And that's great in the short term because we want our joint to feel safe while it's healing. But in the long term, this can lead to issues with motor control, stability, and like a decrease in strength, because essentially muscles want to be long and strong. So in order to be strong, a muscle has to be able to lengthen to its full length in order to fully contract and be strong. But if your muscles are already in that short and contracted tight position, they can only contract so much more, which just leads to weakness. So you can imagine I'm able to contract a lot more if I'm this long than versus this long. So another one of the important phases of rehabbing an injury is once you regain that full range of motion, you want to also make sure that the muscles are loose. That way you can properly, retrain that motor control and regain that strength. I mentioned motor control. What is motor control? So motor control is essentially your brain telling your muscles around the joint when to fire to stabilize that joint effectively. So especially in like the ankle injury that I gave, it's really important to retrain that motor control because a lot of balance happens at the ankle as well as the hip. So we want to retrain motor control and balance in both areas because you need balance for running, because a lot of running is on one leg, even walking, and especially any sports movement where you're pivoting. Maybe you golf, so you're rotating. Maybe you play tennis, same thing, rotating. Or if you are a runner, or if you're a yogi and you're standing on one leg during your practice. Balance is extremely important, and motor control helps with that balance just to stabilize you. Also, if you're like a high performance athlete or just looking to improve performance, stability and motor control is really important because if you aren't optimally balanced, that just means that while you're performing, so maybe while you're doing your CrossFit or maybe while you're squatting, while you're running, your body is leaking energy to help stabilize you. But if you didn't have to work so hard to stabilize, you could use that energy towards your performance to squat heavier, run faster, and squat and run longer. That's another reason why it's really important to retrain that motor control. And that kind of leads me into the next point of how you come back stronger. So a lot of times with our athletes and just patients in general, we found that we don't really know whether or not that they were lacking motor control before the injury or after. But by working on that essential motor control component, that's kind of how you can prevent future injuries as well as set yourself up for success with strengthening and like how to come back stronger. So you come back stronger by working on the quality of your movement, not the quantity of your movement. If you're going more for strength going into the gym, 3 sets of 10 is great. But if you don't have that stability while you're doing those 3 sets of 10 exercises, like we said, energy is going to be leaking and you're just leaving weight off of the bar. And you could be a lot stronger if you worked on the quality of your movement, which would be, am I able to squat through my full range of motion? Am I able to effectively stand on one leg? These are all important things in order to optimize that performance of that squat. By working on your motor control, you are able to more effectively strengthen, which will help you come back physically stronger, but also your body will be stronger. Kind of the clues, and this is a great at-home test you can do. So even if you're not injured, you can do these 2 tests to see, do I have a motor control problem? A lot of times what we like to have people do is just stand on one leg with eyes open. Can you balance there for 10 seconds? And try both sides because you might find that you are lacking on one side versus the other. That's great. That's just the baseline if you pass that. But what we truly like to see is that folks can stand on one leg for 10 seconds with eyes closed. And this is kind of checking that ankle stability, the hip stability, and your core stability as well. And it's a really challenging movement because our body for balance depends 80 to 90% on your visual system, and we just took away your visual system. So this is all that neuromuscular control and balance that we want to work on. If you had trouble with that test, or if you're someone who is injured and you're really not sure how to get back your range of motion, or if you got your range of motion back but you are not feeling strong and performing as well as you would like, and you think motor control / stability might be that missing link for you, we would love to offer to you a free total body diagnostic. In this free total body diagnostic, what we would do is take a look at you head to toe and perform some more testing, kind of like the single leg balance test that I just talked about, to kind of see where you're at range of motion wise, where you're at stability wise, listen to your goals and where you want to be performing, and then come up with a plan to help you reach those goals. It'll tell you what the problem is. Do you have a mobility problem? Do you have a stability problem? And lay out a plan for how to make sure that it isn't a problem anymore, to get you back to reaching your goals, crushing it, and coming back stronger than before and preventing future injuries. So if this sounds like something that you are interested in, give us a call at 336-271-6677. Before I go, don't forget to click the subscribe button, the like button, comment below with what your greatest insight was or something that you learned from this video, and click the share button to share it with someone who you think could benefit from watching it. So once again, if you are interested in that free total body diagnostic, give us a call at 336-271-6677.